Fertility. How can I protect it?
Do I want children?
Should I have a career before children?
Who will take care of me when I'm old?
Do I want many children or only one child?
What if I'm interested in the same sex?
Am I even allowed to think about this? In my culture, nudity and sex are taboos.
Yup. You might need to consider these things many times during your life. However, there are things you may not be able to influence on later. Your choices can have far-reaching consequences on your or your partner's fertility. Fertility means the ability of a person to conceive. If your fertility is impaired, having children might be difficult. Sexually transmitted infections.
What happens to me if I have sex without a condom?
You can prevent sexually transmitted infections only with a condom. Sexually transmitted infections can affect fertility. For example, chlamydia can cause pelvic inflammatory disease, which can cause infertility. Use condom both in sexual intercourse and oral sex. Did you know that you can use a condom when you give oral sex to a woman? A male condom can be used once you first split it with scissors.
I have no symptoms, so it doesn't matter if I don't use a condom.
The fact that you have no symptoms does not mean that you don't have a sexually transmitted infection, so get yourself tested. Alcohol and drugs.
It doesn't matter if I drink when I'm young, does it? I will have children only when I'm older.
When you are drunk, you might forget to use a condom, and then you are at risk to get a sexually transmitted infection. Drug use or depression can also cause risky behavior. Alcohol can also delay the onset of puberty, and continued use of cannabis can affect the quality of semen.
A friend of mine gave me snus. Should I try it?
Smoking and using snus can lower semen quality. Nicotine is poisonous to the uterus, and smoking impairs the function of the ovaries. Snus may contain 20 times more nicotine than tobacco. Some electronic cigarettes also contain nicotine. Body weight, eating disorders, and exercise.
Does my body weight affect fertility?
Significant obesity can have a negative impact on boys' sperm count. Significant obesity affects girls' fertility as well. A BMI higher than 29 lowers the chance of becoming pregnant. Even a 5% weight loss improves fertility in the significantly obese. Underweight affects fertility, especially in girls. Ovarian function may fade and menstruation cease. This can affect fertility in the long run. Underweight can lower the quality of semen. Eating disorders also affect your fertility. Anorexia causes infertility. Bulimia or binge eating disorder usually causes menstrual disorders in girls.
I'm at least healthy since I pump iron every day.
Moderate amount of sports is good for your fertility. Long-lasting competitive sports can be a risk to your fertility because excessive training affects your hormones. Stress.
I'm always busy on social media and on many different channels at the same time. Meanwhile, I should study. Doesn't matter.
Stress also affects fertility. Stress affects your hormones and can cause irregular menstruation. Stress can lower sperm count and motility. Microplastics and chemical substances.
I heard that you can order cool clothes at a reasonable price from China.
It's good to have a look at what your clothes are made of. With your own consumption choices, you can prevent excessive exposure to harmful substances. Microplastics and, for example, phthalates are suspected to affect fertility. Age and infertility treatments.
In vitro fertilization, that is a good option at a later age, right?
Fertility treatments cannot overcome the age-related challenges of conception and having a baby. Age affects fertility. Women's fertility declines at the age of 32. Men's fertility starts to decline at the age of 40.
You can make a difference with your own choices.
Choose smartly.